Okay, welcome to this product demonstration video where we're just going to talk to you a little bit about how to test for cannabis and what your options are when you're looking on the internet to buy a test for screening somebody that you suspect may be using cannabis, or where you're screening yourself to look if cannabis has been consumed or excreted fully from your system. Now, what we've got showing in front of you here is the three common routes for doing cannabis testing. On the right here we've got a combination saliva test with a cannabis membrane, which is this brown one built in, and this has been run previously, so you've got the results showing there for a negative cannabis test result. The THC membranes on most of these tests, now you do have to with saliva look carefully at what sensitivity you are buying, but they will be around 12 nanograms as a standard base to start with. Now that will only give you cannabis detection in saliva for between 8 and a maximum of 14 hours after it's been used. Now the cannabis in saliva will naturally become positive quicker than a comparable urine screen after it's been consumed, but it's important for you to bear in mind that relatively short window after cannabis has been used for you to detect it using a saliva route. Now compare that to these other two tests that we've got shown in front of you here. This is a panel or cassette test for cannabis, THC, and this is the equivalent urine strip test for cannabis. Both these are for human urine screening, and both have a sensitivity of 50 nanograms, which on the face of it you're thinking it was far less sensitive than the equivalent saliva. But a 50 nanogram urine THC membrane has the ability to detect cannabis use for between 3 and a maximum of 5 days after cannabis has been consumed. So a much more extended window for detection compared to the saliva test, even though you're looking at an equivalent lower level in terms of nanograms per mil. And the reason for that is cannabis is excreted in urine for a much longer period of time, being fat soluble, tends to be deposited around the body and gradually leaches out through the urine system. So if you are looking back in time and wishing to screen for cannabis, then we would always recommend looking at urine as a principal first choice route for cannabis detection. Saliva obviously has the advantage of being able to take a sample without any embarrassment, not having to handle a urine sample, and being able to run the test there and there in front of the person quite easily. You will struggle probably to find single or individual cannabis test strips in the UK market. They tend to be, because of the costs, loaded into a combination panel such as this one where it's screening for cannabis and another 5 drugs. Far easier to buy single or multiple packs of either strips or cassettes for cannabis detection on urine, and both these basically will give you more or less identically accurate test results. So you're looking at between 99% comparison to a gas chromatography mass spectrometry for the urine, and between 98 and 99 depending on the manufacturer for the saliva in terms of its accuracy. And when we talk in terms of accuracy, we are talking compared to the gold standard laboratory tests for either saliva or urine, which in all cases would be a GCMS or a LCMS laboratory analysis for cannabinoids. So there you have it, the three options for cannabis screening. Our recommendation is, in the first instance, if that's the only drug you're looking for, always go down the urine route, because you're going to pick up for a much longer period of time and it's just as accurate. If you can't handle urine testing, then saliva is a perfectly good option, but you need to be aware that you need to screen within that 14-hour window to get your positive result, and that after that your results will have gone negative and you won't be able to detect it unless you move back to doing a urine test or a hair test is your other option. So there you have it.